The University of Tennessee Medical Center is our region's only academic medical center. Our mission is to serve through healing, education, and discovery. Our goal is to share the knowledge of our physicians and staff in these health education videos as you make healthcare decisions for yourself and your family.
Hip joint arthroscopy is a procedure that's been around for about 10 or 15 years. It's a procedure that utilizes small incisions around the hip joint to evaluate and treat a number of different conditions that can cause pain and dysfunction around the hip. Hip arthroscopy can treat a number of conditions around the hip joint. One of the most common conditions that we take care of at the hip joint is something called femoral acetabular impingement, otherwise known as FAI, is commonly seen in the literature and even in social media. Impingement of the hip joint basically involves trying to fit a square peg into a round hole. What happens and can happen developmentally or through trauma is that there are some abnormal prominences on the ball and or socket that can cause tears to some of the cartilage around the hip joint. It's probably pertinent to take a few minutes and talk about some of the anatomy of the hip very briefly. The hip joint is made of a ball and a socket. The socket is lined with a thick cartilage ring that's called the labrum that helps keep the ball sealed in the socket. And then lining the joint itself, there's articular cartilage that helps cushion the joint. Impingement of the hip joint happens when there is repeated flexion of the hip joint. If there's abnormal bone on either the ball or the socket side, can actually cause pinching of the labrum and the cartilage inside the hip joint. Arthroscopy allows us to treat this problem by removing the bone and addressing the cartilage tears. Other things that can be taken care of through arthroscopy include possible loose bodies, infections. There are certain snapping tendon disorders around the hip joint that we can address through small incisions that allow patients to recover a lot faster. Hip arthroscopy is done through a number of small incisions around the hip joint. We utilize a number of different small tools, all about the size of a pencil, that allow the surgeons to access the inside of the hip joint and address whatever is causing patients problems. The benefits to hip arthroscopy is then traditionally, to treat some of these problems, surgeons would have to make large incisions over top of the hip joint to address these problems, sometimes even having to surgically break the bone and dislocate the hip joint to access some of the problems with the cartilage and other soft tissues that were problematic. Hip joint arthroscopy is similar to both knee and shoulder joint arthroscopy in that the surgeons utilize small incisions and very similar cannulas and tools around the joint itself to address the problems inside the joint. The difference between hip arthroscopy and knee and shoulder arthroscopy is that it is a much more technically demanding procedure, not done by many surgeons because of the steep learning curve. But once this curve is mastered, it allows the surgeons to safely navigate in and around the hip joint to take care of the problems. The recovery for hip joint arthroscopy varies from patient to patient, but usually I have patients on crutches for about 2, 3, 4 weeks after surgery, depending on how much work is done in and around the hip joint. I usually allow people that have a sit-down or clerical job go back at about 2 or 3 weeks. Those patients that have a more physically demanding job, I usually ask them to wait at least 6 to 8 weeks before they go back to work. I usually allow sporting activities to return at about 3 months, and I always tell patients they have about 3 to 4 months of a little bit of residual pain and discomfort just because of the nature of the procedure itself.
We hope you'll join us soon for another medical moment. Visit utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970 to learn about services available at the University of Tennessee Medical Center.